Initially, the immunotherapies were all started off in patients who had stage 4 cancer. They realized that certain set of people would have a phenomenal response. A stage 4 cancer, 3 to 5% would get cured, complete response. This was actually very exciting news for us oncologists. But then they realized that certain people would not do well and they would have disease progression despite taking immunotherapy. Then they started understanding as to how can they identify who's the ideal candidate. Can you give immunotherapy to everyone? No, it's not going to work for everyone. You need to select and sub-select your patients. Only then will you get success with it and the patient will not get toxicities. Your tumor tissue that is there, we will have to see whether it has the necessary receptors for the immunotherapy to act on. So what you would do is you would take a biopsy. After you take the biopsy, you will do certain tests on it. It's called EDL1 testing or mismatch repair gene testing. It's called MSI, microsatellite instability. Once you do these tests, if these come positive, these give you an indicator that immunotherapy would be useful for these patients. A patient should be in good performance status. That's a very important entity. The patient should also not have very strong or active autoimmune condition, because this is actually using the immune system to kill the cancer cell. If it goes onto an overdrive, it can actually lead to some amount of autoimmunity. Like autoimmunity is like your systemic lupus erythematosus, Sjogren's syndrome, rheumatoid arthritis. We have to be a bit careful in these kind of patients. But for us to understand, stage 4 cancers, where you've as a second line or a third line, now it's even come up to first line. Like in lung cancers, if you have these certain markers positive, you can offer it to your patients upfront in a stage 4 setting. It's also now come into stage 3 setting. Like in CA lung, after you do your chemo radiation, you will go ahead and give the immunotherapy as an adjuvant to prevent the disease. And it has a fantastic response in the sense that it almost increases your survival by around 5 to 6 times when given in a CA lung, that is a carcinoma lung, post a chemo radiation, that's in stage 3 CA lung, after you have done the appropriate protocol therapy. It increases your lifespan by almost around 5 to 6 times when compared to not having any further treatment.